The World Health Organization said coronavirus cases jumped by 11% in Europe in the last week, the only region in the world where COVID-19 has continued to increase since mid-October. In its weekly assessment of the pandemic released this week, the UN Health Agency said cases and deaths globally have risen by about 6%, with about 3 million new infections and 51,000 new deaths reported in the previous week.
We have just surpassed, very sadly, the 1.5 million death mark last week. If we continue on the current course, we are projecting a further over 500,000, 500,000 deaths by spring next year. That's really worrisome. Of course, public health cost, the cost to our economies, the stress on our hospitals and communities, and our ICUs, of course, our intensive care units. So we're very concerned. We, in the European region, the 53 member states that WHO regional office here in Copenhagen serve, only 54% of the population of this region are vaccinated. So there's so much work to be done still. We're not there yet. And it looks like we're going to have a worrisome season ahead. It's partly due to there being too many vulnerable populations to infection of vaccination. Also, we're seeing waning immunity of these vaccines, especially around after the 30-week mark of the full course. Also, we've got, as I say, 45, 47% of the entire population unvaccinated. And the unvaccinated, let me be absolutely clear, the majority of people in intensive care units and ICUs today are the unvaccinated.
Meanwhile, health officials in the U.S. are urging Americans to take precautions as they hit the skies for the Thanksgiving holiday.
More than 40 million Americans are expected to travel this week, and officials are worried about a surge in infections. COVID cases are already rising in 24 states, and hospitalizations are also up across the country. Officials are asking unvaccinated people to delay travel and for those who are vaccinated to wear a mask in indoor settings. But with so many Americans determined to reclaim Thanksgiving traditions that were put on hold last year, it remains unclear whether those recommendations will have an effect.